Okay, great. All right, so the place that I want to at least start at is in the social policy realm. And so just as a general way of kind of like level setting about how things might work in the United States, state governments, by virtue of their authority, their vested powers, with the police powers, as I'm sure we're all familiar with, are essentially in charge with implementation, being on the front line of addressing these policy issues. Whereas the federal government is essentially there to help coordinate overall big picture, as well as provide financial support. And so ultimately what this means is that for federalism to work effectively, dealing with social policy, but particularly public health questions, we need there to be coordination. What is particularly important about this setup, though, is that our version of executive federalism comes to bear. Because when states are effectively in charge with implementation, this gives prime authority to the executive power, which are state governors. And so as a result of this, of course, because each governor is going to be different, leadership styles, partisan predispositions, all these things, we're of course going to see lots of diversity and heterogeneity in terms of the response. What I do want to try to focus on in this talk, though, is state capacity. And in particular, the type of authority that each state governors actually have. And so I want to focus on two dimensions specifically, and that is the ability for state governors to act unilaterally through executive order provisions, as well as how much individual autonomy they have to be able to act. And in this sense, it's whether or not they can act without the legislature coming over and overturning their decisions. If we look at the types of responses that states engaged in during the first year of COVID, and in the first year of COVID, again, as we've talked about and noted, was an incredibly unforeseen event, and no one knew how to respond. And so this is pre-vaccines, and so we had a number of non-pharmacological responses that were available, so whether that included a variety of masks, so public masking, business masks, wearing masks in schools, to stay-at-home orders and quarantines. We can see that there was a great variety and diversity of responses amongst the states. And of course, politics enters the fray. We had some states that were controlled by Democratic governors, some states controlled by Republican governors that were unified, some that were divided. And so this, of course, entails, because of federalism, we should have an incredibly messy response across all the different states, because of course political authority is not being unified and coordinated at the top, and so it is going to fragment pretty heavily at the state level. So a couple of hypotheses just to kind of get us focused here. One is that we should expect, and this goes back to, I guess, Roman times with Caesar, right? If we have an emergency, we're going to give one person control and they're going to lead us through. And so the idea here is that if we increase state capacity for governors, give them a lot of authority to act unilaterally, right? Give them a lot of autonomy, then they'll be able to take corrective action to be able to lead us through the crisis. And of course, we need to think about how politics is going to play. Political polarization has been dominant in the United States. In fact, it's been the dominant explanation for how the United States responded towards COVID. Scholars like myself have attributed the differences in political control at the state level as the reason why states reacted the way that they did. So the data that I'm pulling from is from the COVID-19 State Policy Project at the University of Washington, which was a collaboration between policy experts, political scientists, epidemiologists, the Book of the States from the Council of State Governments, and of course the United States Census. So what I've got at least for you here to look at is the number of restrictions that each state's governor put into force over, again, that first year of the pandemic. So again, just to remind you, I'm looking at just those 5 types of restrictions. But you can at least kind of see a pattern emerging here, that most states ended up taking multiple restrictive measures into place. But the states that engaged with the fewest number of restrictions all tended to be controlled by Republican governors. In terms of the models, I don't obviously want you to focus on numbers per se, but we're going to basically look at a number of these different things. We've got a different model for each restrictive order, as well as the total number of restrictions. And so what we've just looking at here is the state capacity variables. And so I've bolded the variables that are actually statistically significant and predictors of whether or not a state adopted any of these single restrictions, as well as the total number of restrictions overall. What we can at least see is that executive order provisions were incredibly powerful. They helped to explain whether or not a state adopted both public, business mass, quarantine orders, and just the total number of restrictions overall. Legislative overrides also similarly impacted the states, but the big thing is this idea that the effect is all negative. It's going in a completely counterintuitive direction. And so we'll talk about that in a moment once we get through the political variables. Now again, every scholar that has looked at the United States has attributed everything that's happened according to partisanship. And we see that on display when we're looking at the decision to adopt a public mask mandate. But functionally, that's it. No other actual political factors are driving really anything. The identity of the governor, divided government, even the interaction between the two to try to catch those scenarios where we've got a Republican legislature, Democratic governor, and then vice versa, as well as the number of votes that Trump got in the 2016 election. None of those factors are really driving anything. The state capacity measures seem to be much more important. And just looking at state demographics, because, you know, maybe it's about the state characteristics. That's what's driving why governors decided to do things or not. So the most vulnerable populations, the population over 65, that's not driving anything. In the first few months of the pandemic, African Americans were the hardest hit demographic. That's not affecting anything. How wealthy citizens in the state are, that's not driving anything either. And so, of course, when you translate statographs to PowerPoint, we always have some issues. But what I really just want us to focus on is these two lines, this blue line and that red line. The blue line is states controlled by Democratic governors. The red line is states controlled by Republican governors. And this is that executive order provisions variable and the legislative override percentage variable. This is why it was so interesting and important when we're seeing the coefficient sign being negative. Essentially what we're seeing here is that governors across Democratic states and Republican states, the more power they have, the less likely they're to use it. Governors that are constrained in authority were much more likely to use that authority to enact these restrictive provisions. And it's the same thing in terms of autonomy. Those governors that were staring legislatures down, that had a very easy time being able to override them, they were more likely to act than those governors that were completely insulated. This is incredibly important because what it's helping us to do is shift our understanding now that we've got a little bit more distance about what was happening in the United States. No doubt that politics matters, as it always does. But thinking a little bit more deeply about how executive power is arranged at the state level, how much autonomy, how much unilateral authority the executive actually has, this is driving what's happening here. And so what I'm seeing is that executive power that's restrained, that is not open-ended, that is not this Caesar-type Roman model of giving the executive everything. They don't use that power. Now, part of this is the speculation as to why that is, and hopefully we'll get into that in the Q&A. But what I hope this does is to challenge us to start thinking about why we constantly feel the need to build up the executive authority, especially given the types of dynamics that we're seeing around the world today, growing illiberalism, growing authoritarianism, and why it might be necessary to rein in the executive in order to functionally, successfully manage a pandemic. Thank you.
Wonderful. Excellent time management, actually. You could have taken also a couple of minutes more. But I'm sure that in the Q&A we will come back to you with questions. So we now hear the Australian case, and I hope Alan Fanna is online.
I'm doing my best to be online.
That's great. Hi, Alan. It's a pleasure to hear you. I don't see you yet, but yes, now we see you.